Hey biology students, this is the last video that I will make for the immunology unit, and this is a wrap-up video, and the title is Acquired Immunity. So before we get started, I would like to show you a little animation that reviews the adaptive immune response and introduces the concept of vaccination.
Vaccination, the administration of a vaccine, the antigenic material from pathogens, prepares the body for future infections by a specific pathogen. When a vaccine is first administered, an antigen-presenting immune cell, or APC, such as a dendritic cell, engulfs the antigen from the vaccine, degrades it, and displays pieces of the antigen on its surface. APCs then activate T helper cells, or Th for short, that trigger cytotoxic T lymphocytes, or CTLs, also known as killer T cells, and B cells. Once activated, CTLs are able to detect infected cells, bind to the cells, and release chemicals that kill the cells, along with harbored pathogens. Post-activation by Th, B cells divide into plasma and memory B cells. The plasma cells make antibodies that bind to vaccine-introduced antigens to destroy and eliminate them from the body. After the vaccine-induced mock infection is cleared, some T cells get converted into memory cells that can readily divide and grow whenever re-exposure occurs to the same pathogen or its antigens in the future. The memory cells and antibodies generated via vaccines against a specific pathogen remain in the body for months or years at a time, depending on the vaccine. When an individual gets infected by the same pathogen or antigen that they were vaccinated against, the memory cells will recognize the antigen and can divide rapidly to produce a quicker immune response.
Okay. So when we talk about acquired immunity, we're going to use some vocabulary to describe that. So we use the word active, and that means that the body itself is going to create the immunity. So there's going to be antigen introduced to the body, memory cells will be developed, and that immunity is generally long-lasting. Compared to passive immunity, here, the body receives immunity from somebody else. And because that immunity is transferred in the form of antibodies, there are no memory cells that are produced, and that immunity will be temporary. Then we use this word natural. We're defining that as immunity derived from innate biological processes versus artificial, where there's a medical intervention designed to produce the immunity. So let's put all these vocabulary words together, and usually I draw this on the whiteboard. So we put the words together and we combine them and get these four boxes, which represent the four types of acquired immunity: natural active, artificial active, natural passive, and artificial passive. So let's go box by box and give an example. So natural active. Well, this is when you get sick, naturally. You go about your day, somebody coughs on you, and lo and behold, a few days later, you develop a respiratory illness because that person transferred the pathogen to you. So there you go. You are going to have an immune response. You're going to create your own memory cells, and you're going to have long-lasting memory to that. All right, how about artificial active? Vaccinations are an example of artificial active immunity. So here, artificial, remember, is a medical intervention. However, this medical intervention, the vaccine, actually allows your body to develop the memory cells in the same way that you would if you had the natural infection. The only difference is that you don't actually get the symptoms of the illness. Natural passive, another process that occurs as part of our normal biological processes, includes when females are pregnant animal mothers actually protect their baby. They do so in utero, so IgG protects the fetus by crossing into the placenta and keeps the baby in basically a sterile bubble throughout the pregnancy, so the baby never comes in contact with any pathogens or any bacteria for that matter. And if they do, they receive this protective antibody from mom. Also, when baby is born, we breastfeed, or it's recommended to breastfeed for at least 12 months of life to provide your baby with IgA. And that's because when baby is born, baby is just developing the ability to create its own memory cells, and that takes about a year for all of that to get running properly. So in the meantime, the breast milk provides some temporary immunity for the baby. And so those are specific antibodies that are being passed from mother to baby. But that means baby will not have memory cells to whatever mother had. Artificial passive. A lot of people are unaware of what this type of acquired immunity is. So artificial means it's going to be, again, a medical intervention, and passive means you're going to be getting immunity from somebody else. So have you ever heard of people who get bitten by let's say, a poisonous snake, rattlesnake? And what happens? Well, hopefully they get to an emergency room, and when they get to the emergency room, they will be prescribed something called anti-venom. Well, anti-venom is actually an antibody. It's an antibody from somebody else. So this is called anti-serum or anti-venom. It is an antibody transfusion. So they'll give you an injection of anti-serum, which is somebody else's antibody that is specifically designed to go after the particular toxin. So, snake bites or black widow spider bites, they have injected a venom, a toxin into your bloodstream that can have potentially deadly effects depending on your age and overall body size. But we would want to block the action of those toxins. And how do you neutralize toxins? Well, you can do that by antibodies binding to the toxin. So snakebite treatment is one example. Black widow spider bite treatment would be another example. RhoGAM is actually a medication that's given to pregnant mothers. If you are Rh negative, that's a particular blood type. So RhoGAM is given to Rh negative pregnant women. This is something to do with your blood type. So do you know your blood type? So usually your blood type, if you know it, you'll know if you have a positive or negative status. In other words, are you O positive? Are you A positive? Are you B negative? And if you have a negative, that refers to a particular sugar on the surface of your blood is absent. So if your baby has an Rh positive blood type, what can happen is that the mother can actually develop antibodies that attack the baby's blood and can be harmful to the baby. So RhoGAM is an antibody that prevents any of baby's blood from getting into the maternal circulation. So now the rest of the lecture, we're going to focus on vaccines. And first I'd like to describe the impact of vaccines. And I'm only going to give you a few examples. So if you were alive in the year 1900, the annual number of smallpox cases was 48,000. Today, there is not one case of smallpox since 1949. and it was eradicated worldwide in 1977 as a result of a pretty universal vaccination. Used to be a pretty horrible disease with nearly 100% mortality rate if you became infected. So talk about a pandemic. We are in the midst of a pandemic right now of coronavirus, but lucky for us, coronavirus has a mortality rate of what's looking at least less than 3%. And that's pretty good compared to smallpox, which has a mortality rate of pretty close to 100%. So imagine if we were in a pandemic with a 100% mortality rate. We would be in much worse shape, of course. How about polio? So in 1954, the annual number of polio cases was 35,000. This is in the United States, by the way. Today, not one since 1979, thanks to the polio vaccine. In this picture, this is a historic picture showing a nurse in the 1950s treating children affected by polio, and they're in this machine that's called an iron lung. And the iron lung was basically a way to artificially help the children breathe mechanically because of the effects of polio was affecting their nervous system and their muscles, and they were having trouble there was respiratory distress is one of the complications of polio, as well as a nerve damage and paralysis that lasts the rest of your life. It wasn't uncommon for children to contract polio, especially in the summer months, and to become paralyzed, and for several of your classmates to be paralyzed from polio from the summer becoming infected. How about diphtheria? Used to be the leading cause of death in children prior to 1930. Today, not one since 2003. Diphtheria is protected today by the diphtheria vaccine, which is given as part of your DTaP vaccine. This is a picture of someone infected with diphtheria, where they get this very classic pus-filled membranous gray material that forms in the back of their throat. So thanks to Edward Jenner, the English physician Edward Jenner, who developed the very first vaccine, we have this really, really amazing tool in science. So he developed the first vaccine, and actually this is where the word vaccine comes from, because the word vaca refers to cow, and Edward Jenner, so this was approximately the 1790s, Edward Jenner doing his experiments, and this was around the time of some really terrible smallpox epidemics where lots and lots of people were dying. Millions were dying worldwide. And Edward Jenner was a physician, and he noticed that milkmaids who worked with cows and milked the cows would develop a similar infection to smallpox, but it was called cowpox, and this is actually a picture of cowpox. So cowpox, of course, infected the cows, but it could transmit to humans. However, in humans, it caused a much milder disease. You would still get these lesions, these sort of pus-filled, gooey lesions on the skin, but it wasn't lethal. It wasn't a deadly condition. And what he found was that these milkmaids would get cowpox, get a relatively mild infection, but they never would get smallpox. They never got smallpox. And so he hypothesized that there was something about getting the cowpox that provided immunity and protected you against smallpox. So he began vaccinating people in the early 1800s, but vaccination back then was a was actually a pretty scary ordeal because they didn't know very much about aseptic technique. There, hand washing and all of that would not become a big thing for about another 50 to 100 years. So it was sort of a scary ordeal. From what I've read, how this worked was you didn't want your kids to get smallpox, okay? Because smallpox meant your child would likely die. Like it was a 99% mortality rate. Very, very, very scary. So, on one hand, if you did not vaccinate your child and your child contracted smallpox, very high likelihood that your child would get smallpox and die. But option B was you go see your physician, and this is how they would vaccinate you. They would take the pus from somebody who had cowpox. So look at this person's arm and see all those lesions all nice and filled with pus. Yeah, there's a lot of cowpox virus in there. So what they do is they would just scoop out some of the pus from somebody who had cowpox, and then they would inject that into your healthy child's arm, and that would be their vaccine. So can you imagine, as a parent, either you do nothing and wait to see if your child gets smallpox and dies, or you take your child to see their doctor, you get basically they just cut into your healthy child's arm with a not a sterile knife, just sort of a gross, gooey knife that they've been using on all the other kids they've been vaccinating all morning. And they just cut into your child's arm and take a scoop out of the cowpox lesion that they have, and they just mix it in there with your bloody wound and tell you to go home. And there you are, you're protected from smallpox. But what happened was because they didn't know anything about germs, really. I mean, they didn't even understand why vaccination worked. They didn't understand why, they just knew that it did. They didn't use any sterile tools at all. And what happened was a lot of kids would get a secondary bacterial infection, as you can imagine, because you'd have this big open wound where they vaccinated you, and you would get gangrene and your arm might turn black and fall off. So there were sort of two very scary realities back then. You either get the natural disease or you go get vaccinated and you get some sort of infection from the vaccine process. So it was a scary time. Nowadays, vaccination is the most highly regulated medication that we give in this country. It goes through the most rigorous testing, and obviously we use good sterile technique nowadays. So you do something called single dose vaccination, where one vaccine from one vial, we're not even redipping from the same vial to give multiple vaccines to different people. It's all very, very sterile. You don't have to worry about secondary infections. You get a very well tested and this technology that's really 200-year-old technology, but it works. It works great. And based on your understanding of the immune system, hopefully you understand why that is. And one of the things you can realize when you get a vaccine, not only are you protecting yourself against the whatever you're vaccinating yourself for, you're protecting yourself from getting that disease, but you're also protecting everyone around you. So there's this two-part protection that's happening when people vaccinate. So you're protecting yourself, but it's also a public health service to vaccinate yourself because you protect people who cannot get vaccinated, and that might be because they're too young. So you get vaccinated and you protect that baby on the subway who is too young to get a particular vaccine, and you got the vaccine, so now you're protecting them from the disease, or you're protecting that elderly person who's too weak or immunocompromised to get vaccinated. But you getting vaccinated, you protect them from getting the disease. We call this concept herd immunity. It's a really important concept to understand regarding vaccinations. So in this diagram, we see what happens in the first diagram where we have non-immunized but healthy people in blue, and then we have the non-immunized, sick, and contagious people in red, and then we start getting spread to all the blue people, and soon we get this epidemic where a whole bunch of people get sick, compared to the bottom diagram where we do have some non-immunized but healthy people in blue, and we have some sick people in red, but then all the yellow people are the immunized healthy people. Notice how they're providing a barrier of infection. They are actually protecting the blue people. They're protecting the people who are not immunized. And that is what herd immunity can achieve. So you can achieve this from vaccination. You can achieve it from enough people coming down with an infection, and recovering from it can provide this barrier, but that means a lot of people have to get sick. As opposed to immunization, you don't have to have a lot of people get sick. Okay, so I wrote here on the slide, so the concept of herd immunity, individuals who are immune to a pathogen, either because they were vaccinated or they survived the infection, they act as this barrier to the spread of the pathogenic microorganism. This also helps you understand why there is a vaccine effort right now for coronavirus, because there is no natural immunity right now in our population. So option A is what's happening here. Nobody is vaccinated against it because there isn't a vaccine. So sick people are very contagious and they're spreading it to everybody, which is why we have this quarantine in place, the stay-at-home order, because we don't want to be in crowded areas where this infection can spread quickly. But as soon as there's either enough people that have survived the infection / they develop a vaccine in the next year or so, then we're going to have this barrier and it's going to be safe to be in large gatherings again. Let's talk about types of vaccines. There's really 4 types. So the first 3 fall under this category of being inactivated or killed. So remember, viruses are not technically alive, so we use the word inactivated to refer to a vaccine that inactivates a virus rather than kills the virus. But basically, it's a killed vaccine. So option 1, you can give the whole agent. So this is usually involved in heat killing the agent or using formaldehyde to inactivate it. So some sort of preservative is in the vaccine. So the original polio vaccine, which is called the IPV, which stands for inactivated polio vaccine, the modern day hepatitis A vaccine, as well as the rabies vaccine, are all whole agent vaccines. Subunit, because we know that you don't actually need to get the whole pathogen. Sometimes only just a specific part of the pathogen is needed to get the immune response. So we call those subunit vaccines. We only need a specific antigen, maybe a surface protein or some sort of sugar, polysaccharide sugar, to get the desired immune response and memory cells. So we have the influenza shot. If you get the flu vaccine where they give you the shot, it's a subunit vaccine. The hepatitis B vaccine, pneumococcal, and meningococcal are all subunit vaccines. And then toxoid vaccines. This is inactive toxin. So, for example, the DTaP, when you get the DTaP vaccine, that contains 3 things in it. So the toxoid part would be the diphtheria toxin, inactivated diphtheria toxin, inactivated tetanus toxin, and then what's called acellular pertussis. So this is a portion of the pertussis bacteria protecting you against whooping cough. So those 3 types of vaccines are all in the grouping of calling them inactivated, meaning that that pathogen is either just a part of the pathogen or it's the whole agent, but it's completely destroyed. Therefore, it's not going to be able to cause active infection. 4th type of vaccine we call attenuated or live. Attenuated is just it's a better term for describing for a virus, because viruses aren't really alive. They're attenuated just means to weaken. So they're weakened. Add that word there. Weakened. Okay, so the live pathogen is present in the vaccine. However, it's weakened, usually through a laboratory process. So you usually repeat culture it, sometimes passing it through chicken eggs multiple times so that the pathogen loses its virulence, loses its ability to replicate. I'm sorry, not replicate. It can still replicate. That's actually an important part. It can still invade and replicate, but it doesn't cause severe illness. So this is the modern-day chickenpox vaccine, the MMR vaccine, which protects against measles, mumps, and rubella viruses, the smallpox vaccine, and the flu nasal spray, the flu mist, which is sometimes offered as an alternative to the flu shot. And why would that be? Why would we want a live vaccine? What would be the advantage? Well, in the next slide, we're going to go into that. Let's talk about the advantages and the disadvantages of the two different vaccination approaches. So there definitely are advantages and disadvantages to consider for both types of vaccines. So I already wrote this out. The advantages for attenuated live. So first of all, the big advantage is that this mimics the natural immune response the most closely. So they don't cause, the weakened pathogen doesn't cause the illness, but it mimics the way that it normally would invade the body. So we get both activation of the humoral response and the cell-mediated response. In other words, both B cells and T cells. Another advantage is that usually no booster shots, or very few booster shots, are required for this type of vaccine. So, for example, the MMR vaccine really only requires one vaccination, but a lot of people get two anyways, just to have lifelong immunity to the measles and mumps and rubella, but primarily measles. And that's because it's a live vaccine, so you do get a complete immune protection. Disadvantages. Well, we can't give attenuated vaccines to people with a weak immune system. People who are pregnant, people who are elderly, people who have some sort of other immune compromised condition should not be given the live vaccine. The reason being is that because they have a weak immune system, sometimes they can develop a mild and sometimes even a severe infection. Also disadvantaged, extremely rare, but it is possible for the weakened pathogen to revert back and become virulent. And that word virulent just means disease causing. This did happen. The original polio vaccine was the killed vaccine, but then the oral polio vaccine came out in 1960, and this actually caused 1 out of 2 million people to actually get the disease polio from the vaccine because it was reverting back. And so in the United States, they pulled the OPV, the oral polio vaccine, off the market, and now only the inactivated polio vaccine is given. Let's take a look at advantages and disadvantages for the killed vaccine. So big pro, it's safer. The pathogen is killed, it's completely destroyed. It's completely destroyed. Heat killed or formaldehyde killed. Yeah, it's not going to be reverting back, and there's going to be no problem with that. So that's the modern, that's the today. It's actually the original polio vaccine, but it's the one that we use today. We don't use the live polio vaccine anymore. Another big pro, We can give this vaccine to people with a weak immune system. So, can a pregnant woman get a flu vaccine? Yes, she can. But she needs to get the flu shot, not the flu mist, because flu mist is live and the flu shot is the dead virus or inactivated virus. So that's a huge pro. We can give everybody the killed vaccine. Disadvantages. Sometimes people get a painful inflammatory response at the injection site. It's temporary. So if you get your flu shot and then you maybe, a lot of people get a little bit of soreness, a little muscle soreness at the site of the injection that lasts for maybe a day or two. That's due to the preservatives. So there's formaldehyde as a preservative in these killed vaccines. So some people have that, a little bit of inflammation, maybe even a little redness, swelling, in some cases even a mild fever after getting this vaccine. The other big disadvantage is because it's killed, it's not going to be able to invade the cells like viruses are naturally designed to do. So we don't get any cell-mediated immunity, only humoral immunity. So we only get the B cell, the memory B cells from killed vaccines. We don't get any memory T cells. Another disadvantage is that you don't get long-lasting immunity, so you have to go for boosters. So get your DTaP booster every 10 years so you don't get tetanus or diphtheria or whooping cough. Okay, so that's it for acquired immunity.